You breathe through your nose 20,000 times a day, 20,000 opportunities for your body to either thrive or struggle. 20,000 moments where the shape of your nose becomes the gatekeeper between you and the oxygen that keeps you alive. But here's what nobody tells you about that bump, that curve, that width you see in the mirror every morning. Your nose isn't just sitting there for show. It's not just about whether you like your profile in photos or how you look from the side. Your nose is actually a complex piece of biological architecture that determines how well you can breathe, how often you get sick, and whether you wake up feeling refreshed or like you've been wrestling with a pillow all night. The shape you inherited from your parents, the one you've been living with your entire life, might be the reason you're constantly congested, chronically tired, or struggling with sleep issues you can't quite figure out. What if I told you that the reason you can't breathe properly has nothing to do with allergies, colds, or the weather, and everything to do with the very structure of your nose? What if the answer to your breathing problems has been staring back at you in the mirror this whole time? Think about your nose like a highway system. Some people got born with wide, smooth superhighways that let air flow freely in both directions. Others got narrow, winding mountain roads with unexpected curves and bottlenecks that create traffic jams every time they try to take a deep breath. The difference between these two scenarios isn't just cosmetic. It's the difference between getting the oxygen your brain needs to function properly and spending your days in a fog of fatigue and frustration. Your nasal passages are like a sophisticated air conditioning system that's been millions of years in the making. When you breathe in, your nose doesn't just let air pass through like some passive tunnel. It warms that air to body temperature, adds moisture so it doesn't dry out your lungs, and filters out particles that could cause damage deeper in your respiratory system. But here's the catch. This entire process depends on having enough space and the right airflow patterns inside your nose. If your nasal structure is working against you, this whole system breaks down. Let's start with the most obvious feature that affects your breathing: the width of your nostrils. You might think wider is always better, like having more lanes on a highway means less traffic. But that's not quite how your nose works. Studies have shown that nostril width needs to be proportional to the rest of your nasal cavity for optimal airflow. If your nostrils are too narrow compared to your internal nasal structure, you're creating a bottleneck right at the entrance. It's like trying to fill a swimming pool through a drinking straw. Your body has to work harder to pull air through that restricted opening, and over time that extra effort leads to fatigue and compensatory breathing patterns that can mess up everything from your sleep quality to your cardiovascular health. On the flip side, if your nostrils are disproportionately wide compared to your internal nasal passages, you lose the natural resistance that helps regulate airflow and optimize the warming and humidifying process. Think of it like removing the nozzle from a garden hose. Sure, more water comes out, but you lose the pressure and control that makes the system effective. When your nose can't properly condition the air you're breathing, you end up with dry nasal passages, increased susceptibility to infections, and irritation that leads to chronic congestion. The bridge of your nose tells its own story about your respiratory health. That bump you might be self-conscious about, or the perfectly straight line you inherited from your grandmother, actually affects the internal architecture of your nasal cavity in ways that most people never consider. The height and shape of your nasal bridge correspond to the size and shape of your internal nasal chambers. A higher bridge often means more internal space for air to move around, while a lower bridge can indicate compressed nasal passages that create resistance to airflow. Research has demonstrated that people with certain nasal bridge configurations are more prone to developing what's called nasal valve collapse. This is exactly what it sounds like. The soft tissue areas of your nose, particularly around the narrowest part of your nasal passages, can't maintain their structure under the negative pressure created when you try to breathe in forcefully. It's like trying to drink a thick milkshake through a flimsy straw. The straw collapses under the suction, and you end up getting less than you bargained for. When this happens in your nose, you compensate by breathing through your mouth, which bypasses all the beneficial conditioning your nose is supposed to provide and sets you up for a cascade of health issues. The length of your nose plays a crucial role that most people never think about. A longer nose means air has more time and distance to be warmed, humidified, and filtered before it reaches your lungs. It's like having a longer driveway that gives you more time to slow down before you reach your house. People with shorter noses often struggle with dry nasal passages and are more susceptible to respiratory infections because their air doesn't get adequately conditioned during the brief trip from nostril to lung. But here's where it gets really interesting. The internal structures you can't see in the mirror might be even more important than the external shape you're familiar with. Your septum, the wall that divides your nose into left and right chambers, is supposed to be perfectly straight and centered. In reality, studies suggest that up to 80% of people have some degree of septal deviation. Most of these deviations are minor and don't cause problems. But when your septum is significantly off-center, it creates an imbalance between your nasal chambers that can wreak havoc on your breathing. Think of a deviated septum like having one lane of a two-lane bridge permanently blocked by construction. All the traffic has to squeeze through the remaining lane, creating congestion and delays. In your nose, this means one side does most of the work while the other side barely functions. The overworked side gets inflamed and swollen from the constant strain, while the underused side can develop problems from poor airflow and inadequate drainage. This imbalance often leads to chronic sinus infections, headaches, and sleep disturbances that people attribute to other causes. Your turbinates, the curved bony structures inside your nose that are covered with soft tissue, act like the fins on a radiator. They create turbulence in the airflow that maximizes contact between the air and the moist, warm surfaces of your nasal cavity. When these structures are too large, too small, or positioned incorrectly, they disrupt the careful balance of airflow and conditioning that your respiratory system depends on. Enlarged turbinates can block airflow entirely, while undersized turbinates fail to adequately condition the air, leading to chronic dryness and irritation. The angle of your nostrils, something you probably never think about, significantly affects how efficiently you can breathe. Research has shown that nostril angle influences the direction and velocity of airflow into your nasal cavity. If your nostrils angle too sharply upward or downward, or if they're positioned at an angle that doesn't match your internal nasal anatomy, you create turbulence and resistance that makes breathing more difficult. It's like trying to pour water into a bottle while holding the funnel at the wrong angle. Most of the water misses the target, and what does make it through doesn't flow smoothly. Now here's something that might surprise you. The shape of your nose doesn't just affect how you breathe when you're awake. It has a profound impact on your sleep quality and overall health. When you lie down at night, gravity affects the soft tissues in your nose differently than when you're upright. If your nasal structure is already compromised, the horizontal position can make breathing even more difficult. This leads to mouth breathing during sleep, which dries out your mouth and throat, disrupts your sleep cycle, and can contribute to snoring and sleep apnea. Sleep apnea isn't just about being overweight or having a thick neck. Studies have demonstrated a clear connection between nasal obstruction and sleep-disordered breathing. When you can't breathe properly through your nose, your body compensates by opening your mouth, which changes the position of your tongue and soft palate in ways that can block your airway. This creates a vicious cycle where poor nasal breathing leads to mouth breathing, which leads to airway obstruction, which leads to fragmented sleep and daytime fatigue. The connection between nose shape and respiratory health goes even deeper than most people realize. Your nose is your first line of defense against airborne pathogens, allergens, and pollutants. The shape and size of your nasal passages determine how effectively this filtration system works. If your nose can't properly filter and condition incoming air, you're more susceptible to respiratory infections, allergic reactions, and long-term lung damage from environmental toxins. But don't think that having a certain nose shape means you're doomed to a lifetime of breathing problems. There's actually quite a bit you can do to optimize your respiratory health, regardless of what genetics handed you. Understanding how your specific nasal anatomy affects your breathing is the first step toward addressing any issues you might be experiencing. For people with narrow nostrils, nasal dilators can provide immediate relief by mechanically widening the nasal opening. These simple devices, available over the counter, can significantly improve airflow without any invasive procedures. Breathing exercises that focus on nasal breathing can also help train your respiratory system to work more efficiently with your existing anatomy. If you have a deviated septum or enlarged turbinates, medical evaluation might be worthwhile. These conditions can often be corrected with minimally invasive procedures that dramatically improve breathing and quality of life. The key is understanding that difficulty breathing through your nose isn't something you just have to live with. It's a medical issue that deserves attention and treatment. Humidity control in your living environment becomes especially important if your nose shape makes you prone to dryness and irritation. Using a humidifier, especially during dry winter months, can help your nasal passages function more effectively regardless of their shape. Staying well hydrated also supports the mucous membranes in your nose that are responsible for conditioning incoming air. Sleep position can make a significant difference for people whose nose shape contributes to breathing difficulties at night. Elevating your head and sleeping on your side can reduce the impact of gravity on your nasal tissues and improve airflow. Some people find that nasal strips or internal nasal dilators help keep their airways open during sleep. The most important thing to remember is that your nose shape is just one factor in your overall respiratory health. Environmental factors, allergies, infections, and lifestyle choices all play important roles. But understanding how your unique nasal anatomy affects your breathing gives you valuable insight into why you might be experiencing certain symptoms and what you can do about them. If you're constantly congested, frequently tired despite getting enough sleep, or struggling with recurring sinus infections, your nose shape might be playing a larger role than you realize. Pay attention to whether you breathe better through one nostril than the other, whether your breathing gets worse when you lie down, or whether certain positions or activities make it easier or harder to breathe through your nose. Consider keeping a breathing diary for a week or two. Note when you feel like you're breathing clearly through your nose versus when you feel congested or restricted. Track whether your breathing changes with different activities, times of day, or sleep positions. This information can help you identify patterns and provide valuable data if you decide to consult with a healthcare provider about your breathing concerns. Remember that this information is for educational purposes only and doesn't replace professional medical advice. If you're experiencing persistent breathing difficulties, frequent sinus infections, or sleep disruption that you think might be related to your nasal structure, it's worth discussing these concerns with a healthcare provider who can evaluate your specific situation and recommend appropriate treatment options. Your nose might seem like a simple feature, but it's actually a sophisticated piece of biological engineering that plays a crucial role in your overall health and well-being. The shape you see in the mirror every day isn't just about appearance. It's about function, efficiency, and the quality of every breath you take. Understanding this connection between form and function empowers you to take control of your respiratory health and make informed decisions about your well-being. So the next time you look in the mirror, remember that your nose is telling a story about your breathing, your sleep, and your health. The bumps, curves, and angles aren't just cosmetic features. They're clues to understanding why you breathe the way you do and what you might be able to do to breathe even better. Your nose shape reveals more about your respiratory health than you ever imagined, and now you have the knowledge to decode what it's telling you. What does your nose shape say about your breathing patterns? Have you noticed connections between your nasal structure and your respiratory health that you never considered before? Drop a comment below and share your experiences. And if this video opened your eyes to the hidden world of nasal anatomy and respiratory health, hit that like button and subscribe for more fascinating insights into how your body works in ways you never expected. Share this with someone who's always complaining about being congested because they might just discover the answer has been right under their nose this whole time.